stop what you are doing for a moment, because this is one of those health warnings that most people only hear about after it is already too late. There is a virus that can begin like a simple flu, fever, body aches, tiredness, maybe a little nausea, but in some cases, within a short period of time, it can turn into a life-threatening lung emergency. It is called hantavirus. And the most dangerous part is this: many people do not get exposed in a hospital, on an airplane, or in a crowded place. They get exposed at home, in a garage, in a storage shed, in an attic, in a cabin, in a barn, or while cleaning a place where mice or rats may have been living quietly for weeks or months. My name is Dr. Michael Carter, and on this channel I help adults over 50 and 60 understand the hidden health risks that often go unnoticed until they become serious. Before we begin, please do one thing for me. Subscribe to the channel, give this video a like, and share it with someone who has a garage, a shed, a country house, a cabin, or any place where rodents could appear. And I want you to comment below. Have you ever seen mouse droppings in your home, garage, attic, basement, or storage room? Write yes or no in the comments. This may sound simple, but your answer matters, because many people only realize the risk after they think back to where they were exposed. Today, I will explain what hantavirus is, how it enters the body, the early symptoms you should never ignore, the hidden risks for older adults, and the most important steps you can take to protect yourself and your family. And please stay until the end, because the final prevention step is the one most people do wrong. And that mistake can put the virus directly into the air you breathe. Let's begin with the question most people have never asked. What exactly is hantavirus? Hantavirus is not a new virus. It has existed in rodent populations for a very long time. The virus lives in certain rodents, including deer mice in North America and other rodent species in different parts of the world. The rodent may look completely normal. It may not appear sick. It may run across your garage, hide behind a box, leave droppings in a shed, and disappear. But while it is there, it can shed the virus through urine, droppings, and saliva. And that is where the danger begins. Because hantavirus is not usually spread by shaking someone's hand or standing next to someone in a grocery store. In most cases, people become infected when they breathe in tiny particles from contaminated rodent urine, droppings, or nesting material. Imagine a storage shed that has been closed for months. Inside, mice have been moving around at night. They have left droppings behind old boxes, near tools, under shelves, and around bags of stored items. Then one day, you walk in and start cleaning. You sweep the floor. You move the boxes. You shake out old blankets. You vacuum the corners. And suddenly, tiny contaminated particles rise into the air. You do not see them. You do not smell them. But you breathe them in. That is one of the main ways hantavirus can enter the body. And once it reaches the lungs, the situation can become very serious. Now, I want to be very clear. Hantavirus infections are rare. This is not something you should panic about every time you see a mouse. But rare does not mean harmless. When hantavirus develops into Hantavirus Pulmonary Syndrome, also called HPS, it can become extremely dangerous. The lungs can become inflamed. Fluid can build up. Breathing can become difficult. Oxygen levels can fall. And in severe cases, a person may need intensive care, oxygen support, or mechanical ventilation. This is why prevention and early recognition are so important. Because once the severe lung phase begins, this illness can progress very quickly. Now, let's talk about the first hidden danger. The early symptoms do not look special. That is what makes hantavirus so deceptive. At the beginning, a person may not think, I have a dangerous infection. They may think, I caught the flu. The first symptoms can include fever, chills, fatigue, headaches, dizziness, nausea, vomiting, stomach discomfort, and muscle aches. And one of the classic patterns is pain in the large muscle groups, especially the thighs, hips, back, and shoulders. But here is the problem. If you are over 60, you may already have occasional body aches. You may already get tired more easily. You may assume it is just a seasonal virus, a cold, dehydration, or something you ate, and that delay can be dangerous. Because hantavirus can have a silent window. A person may be exposed and then feel fine for days or even weeks. Symptoms often appear 1 to several weeks after exposure. So someone may clean a shed, open a cabin, work in a barn, move boxes in a garage, or visit a rural area, and then, weeks later, develop symptoms without connecting the two events. That is why I want you to remember this sentence. Flu-like symptoms after rodent exposure should never be ignored. Not because every case is hantavirus. Most will not be. But because if it is hantavirus, time matters. Now, the second danger is the transition from flu-like symptoms to breathing symptoms. This is the moment that should immediately get your attention. In the early stage, the person may feel feverish, weak, and achy, but then breathing begins to change. Shortness of breath, a tight feeling in the chest, a dry cough, a sensation that you cannot get enough air, breathing that gets worse over hours. This is not the kind of symptom you wait on for 3 days. This is not the moment to say, let me see if it improves tomorrow. If someone has had possible rodent exposure in the past few weeks and develops fever, strong body aches, and worsening shortness of breath, that person should seek urgent medical care. And here is something very important. You must tell the doctor or emergency team about the possible exposure. Say it clearly. I may have been exposed to rodents. I cleaned a garage. I found mouse droppings. I opened a shed. I stayed in a cabin. I was around a barn or storage space. Do not assume they will ask. Do not assume they will guess. In a busy medical setting, hantavirus may not be the first thing people think about, especially because the early symptoms can look like influenza, COVID, pneumonia, or another respiratory infection. Your exposure history can change the entire direction of the evaluation. Now let's talk about why this can be more concerning for older adults. As we age, the body changes in ways that can make respiratory infections more dangerous. The lungs may have less reserve. The immune system may respond more slowly. The tiny defense mechanisms in the airways may not clear particles as efficiently as they did decades earlier. And many adults over 60 also have other conditions: heart disease, diabetes, chronic lung disease, kidney issues, high blood pressure, or a history of smoking. These conditions do not mean someone will get hantavirus. But if a serious lung infection does happen, they can make recovery harder. That is why adults over 60 should treat prevention seriously, especially if they live near wooded areas, rural spaces, farms, cabins, basements, garages, or storage structures where rodents may enter. Now let's talk about how to protect yourself. And I want you to listen carefully, because this is where many people make the most dangerous mistake. The first step is inspection. Before cleaning any enclosed space, look for signs of rodents. Do you see small dark droppings that look like grains of rice? Do you see shredded paper, fabric, insulation, or nesting material? Do you see gnaw marks on boxes, plastic, wood, or food packaging? Do you smell a strong, musty odor? Do you hear scratching sounds? Do you see holes along walls, doors, pipes, or vents? These are warning signs, and if you find them, do not immediately start sweeping. Do not grab the vacuum. Do not blow the area with a leaf blower. Do not shake dusty materials. The goal is not to move the dust around. The goal is to prevent contaminated particles from becoming airborne. The second step is ventilation. If you are going to enter a garage, attic, shed, basement, cabin, or storage area that may have rodent activity, open doors and windows first. Let fresh air circulate. Stay out while the space airs out. This helps reduce the concentration of particles in the air before you begin. The third step is protection. Use gloves. Use proper respiratory protection, especially if there are signs of rodents. A simple cloth mask or loose surgical mask is not the same as a fitted respirator. If there is a significant infestation, or if you are older, immunocompromised, or have lung or heart disease, consider having a professional handle the cleanup. This is not about being dramatic. It is about not taking unnecessary risks with your lungs. Now here is the biggest mistake. Many people see droppings and immediately sweep them. That is exactly what you should not do. Dry sweeping can lift particles into the air. Vacuuming can also spread contaminated dust, especially if the equipment is not designed for hazardous material. Using a leaf blower is even worse, because it can spread particles everywhere. Instead, the safer approach is wet cleaning. Spray or soak the contaminated area with an appropriate disinfectant. Let it sit. Then pick up the material with paper towels while wearing gloves. Place the waste in a sealed bag. Then place that bag into a second sealed bag. After that, clean the surrounding surfaces with disinfectant. Wash your hands thoroughly, dispose of gloves safely, and wash any clothing that may have been exposed. The key idea is simple. Do not make the dust fly. Keep it wet. Keep it contained. Keep it out of your lungs. Now let's go deeper into the symptoms, because this could be the most important part of this video. Hantavirus usually does not begin with dramatic breathing failure. It often begins quietly. A person may feel tired. Then fever appears. Then muscle pain. Then maybe dizziness, chills, nausea, vomiting, or stomach discomfort. At this stage, the person may stay home. They may take something for fever. They may drink tea. They may say, "It is probably just a virus." But then comes the turning point. The breathing changes. Shortness of breath may appear and worsen. The person may feel pressure in the chest. They may cough. They may feel unusually weak. They may become anxious because they cannot breathe normally. This is the moment to act, especially if there was any possible exposure to rodents in the past 1 to 8 weeks. And remember, exposure does not always mean touching a mouse. It can mean sweeping a garage, cleaning a shed, opening a cabin, moving old boxes, sleeping in a rodent-infested building, working in a barn, cleaning a basement, handling firewood or stored materials where rodents have been, or entering an old car or trailer that has been sitting unused. Now, I also want to address a common question. Can hantavirus spread from person to person? In most hantavirus cases, especially the types commonly discussed in North America, person-to-person spread is not considered the usual route. The main concern is exposure to infected rodents and contaminated materials. However, some strains in South America, such as Andes virus, have been associated with person-to-person transmission in specific outbreaks. This is one reason why public health officials monitor hantavirus carefully. But for most people watching this, the practical risk is rodent exposure, especially in enclosed, dusty spaces. So what should you do this week? First, check your home and property. Look at the garage, attic, basement, shed, storage room, cabin, barn, crawl space, and any unused vehicle. Second, seal entry points. Rodents can enter through surprisingly small gaps. Seal holes around doors, pipes, vents, walls, and foundations. Third, remove food sources. Keep pet food sealed. Store grains and dry foods in rodent-proof containers. Do not leave garbage uncovered. Remove clutter where rodents can hide. Fourth, set safe rodent control measures if needed. And if the infestation is large, call a professional. Fifth, never clean rodent droppings with dry sweeping or dry vacuuming. This is the prevention step that can make the biggest difference. And finally, know the emergency pattern. Possible rodent exposure, then fever and strong muscle aches, then worsening shortness of breath. That combination should be treated seriously. Go to the emergency room and clearly mention possible hantavirus exposure. Do not wait until breathing becomes severe. Now, before I close, I want to say something very important. This video is not meant to create panic. It is meant to create awareness. Most people will never develop Hantavirus Pulmonary Syndrome, but the people who do often wish they had known the warning signs earlier. They wish someone had told them not to sweep the droppings. They wish someone had told them to mention rodent exposure at the hospital. They wish someone had told them that a flu after cleaning a shed might not be just a flu. And that is why I made this video. Because sometimes the difference between danger and safety is not complicated. It is knowledge. It is opening the windows before entering. It is wearing protection. It is using disinfectant instead of a broom. It is recognizing symptoms early. And it is speaking up clearly when you seek medical care. If you found this video helpful, please subscribe to the channel right now. Give this video a like so YouTube can show it to more people who need this warning. Share it with a friend, a parent, a grandparent, or anyone who owns a garage, cabin, shed, farm, basement, or storage room. And comment below. Have you ever cleaned a place where you found signs of mice or rats? Your comment may help someone else realize they are not the only one who has been exposed to this risk. I am Dr. Michael Carter. Thank you for watching. Take care of your lungs, protect your home, and never ignore flu-like symptoms after possible rodent exposure. And remember, your health often depends on the warning signs you notice early.